discussion. I'm Santosh Kumar. Good afternoon to everyone.
Hi.
Hi. Just I wanted to mention about this on hand washing with alcohol and poisoning, which you have mentioned.
Yeah.
I wanted to find out because we are not sure about the quality of the this hand sanitizer, and we also do not know who is checking and what the standards have been fixed, and whether the market is dominated by spurious kind of sanitizer. People are ignorant about this. People have not been informed by any of the agencies that if we do not know, and we have been using this as a kind of a China Amrit for everyone. Wherever we go, put that as a kind of a life survivor kind of a thing. So how do you suggest that how badly it can affect her, and how we think as a kind of a, even if it is we get into with 30% and is not meeting the standards, and we are putting this as a China Amrit and we are thinking that we are safe, and after that we are using this as a touching hand and mouth. So what is your suggestion of making sure that even if it is spurious, and but we can also still we can be careful and we can save ourselves, and the children also like.
I think that's a bit problematic, and I think that's perhaps something that the government has to address, and they have to be quite strict about regulating this, because it's crucial. As I said, the recommendation is 60% alcohol. When I showed that cartoon, it was very key that I talked about the fatty envelope. Now, the fatty envelope of the COVID virus is its point of weakness. And that fatty envelope, the soap very effectively destroys that fatty envelope and deactivates the virus. That's very, very important knowledge. Not just soap, but 60% alcohol. Now, you're going to have to look online or look for reputable ones that are not harsh or, too drying. And, dermatitis, skin rashes affecting the hands are becoming quite a problem. So I would encourage people to moisturize their hands, as much as possible, as well as, using sanitizers. You can get around it, for children, you can pack, small amounts of, I think you can even get soap wafers where you can, travel, and, even with a water bottle, if you have, you can just quickly wash your hands and keep a hand towel. There are ways to get around this problem. But somehow you are going to have to figure out for yourself that you have a decent product that is safe and that it's doing the job. It's from a reputable company, and that you are using it, and you're making sure that if you're out and about, that before you touch your your eyes, your nose, or your mouth, that you clean your hands. Now, when you're at home, it's not so essential. You're not going to be washing your hands every 5 minutes, because once you're home, and as long as you've made your your household bubble safe, once you've come in the house and cleaned yourself and decontaminated yourself, only before meals and where you're actually going to actively, put something in your mouth is when you're going to be, obviously, like Indians do anyway, wash your hands.
Dr. Sandhya, I have an additional question to it, which you are saying as the safe bubble kind of a concept. Our confidence gets shaken when we get a kind of information that our former vice president, our former president also got affected. Celebrities are getting affected. They are a very close environment. That kind of a movement is not there much. High level, like we have our honorable home minister also got affected, which is a very, very close environment. So, and the confusion which is coming, whether it's airborne or it's not airborne, WHO is not prescribing any kind of a concrete yes or no, because unknown kind of a entity. So how to make our home as a kind of a safer environment, one that we are trying to clean our hands, that is fine, and that I wish to know about how New Zealand could control the quality in that hand washing this sanitizer. And second is that how safe is the home environment, I just mentioned about the two cases and the celebrities and also the VVIPs of this our country.
Well, I mean, I think that's,
And also you have seen that Prime Minister got affected, and so what is this which is coming all the way and making us as a worrisome?
well, I mean, this is the problem. I mean, you are obviously, there is so much community spread in India right now that it is hard to avoid. I think that Dr. Anthony Fauci from the US just did a talk at Harvard a couple of days back, and you know, he has clearly come out and said that there is definitely aerosol spread. Now, I mean, and so the impact of that aerosol spread is that um, the they're saying that ventilation is going to become very important. You know, to allow, especially if you have somebody in your house who has a known who is infected, it is very important to try and reduce that amount of particles in your house by opening the windows as much as possible and allowing the fresh air to allow those particles to dissipate. But as I said, again, although the virus seems to be around everywhere, by following the strict hygiene, you are going to, you may not be able to avoid having contact with particles, but you will be able to reduce your viral load or dose or inoculum by following these strict hygiene methods, and particularly wearing a mask is very important. In fact, they've just come out with the studies are coming out that the countries which adopted universal masking, like South Korea, are having much higher rates of asymptomatic infections, or less hospitalizations, because those people that are getting infected with a much less viral load, and that in itself is almost working as a temporary immunization, you can say. I think people are getting confused. There was a question about how do I test, whether by doing Ayurveda, and how do I test whether I'm immune to the virus or not? I mean, somebody asked the question, even if they haven't been infected. You cannot confuse asymptomatic infection with immunity. I mean, you are having, even if you get an asymptomatic infection, you are still being infected with COVID. You are just lucky that your immune system is, fighting it off in a way that it's not actually causing a lot of symptoms around your body, if you know what I mean. So, I mean, if by wearing masks, we are seeing, if universally, and masks work best, just like an immunization, or, masks work best if everyone uses it. So if 80% of the population wears masks, then everybody, I mean, your protection is actually very good. So even if you do get infected, that infection should be less severe, and that is the basis behind all the steps of my, mild COVID management plan, is that first of all, avoid getting infected. Second, if you do get infected, take every precaution with that nasal rinsing and, mouth rinsing, to try and make sure that that infection doesn't become severe, and that our immunity is able to fight the infection in the upper respiratory tract itself before it heads down to the lungs and to the rest of the body. So, I mean, I'm not sure if that answers your question, Dr. Kumar, Professor Kumar.
You have answered, and this every answer has a lead question all the time.
Yeah. I think we better keep moving through the questions.
Yeah, please go ahead.
So one of the questions actually was about masks and exercise. Now, people asked, should we not wear a mask during exercise? Now, again, it comes down to common sense. If you are going for a walk, and you are going for a walk in an area where there is a lot of people, then obviously you do need to wear a mask, because जैसे इंडिया में काफी भीड़ होती है, like not like New Zealand where maybe there's maybe more sheep than people. You actually need to protect yourself. Obviously, if you're going to be doing heavy exertion, it is not a good idea to wear a mask. The things, I mean, the things to look out for if you are exercising with a mask is if you are feeling lightheaded or dizzy, or you start getting numbness or tingling, you know that you just, you need to stop, you need to take off the mask. So, I mean, if you are to do, there's a lot of exercise we can do in the four walls of our home. So just again, use your common sense. The mask itself doesn't reduce your oxygen saturation, as I had demonstrated in this video I showed last week as part of my talk. This nurse puts on six masks, and his oxygen saturation never drops below 99. So, masks do not affect your oxygen saturation, nor do they cause buildup of carbon dioxide. Now, in terms of protection, again, with masks, it is important that the mask covers the nose and the mouth, and you need to wear a mask. A fabric mask is fine, at least 3 layers. Cotton is best. It's a breathable fabric. Or you can use, your disposable surgical type mask. A face shield alone will not protect you, as demonstrated in this. This is without a mask. This is with a mask. This is with just a face shield. You can see coughing over some liquid nitrogen, that with the face shield alone, you are not protected. So again, this diagram basically showed that if everyone wears a mask, even if somebody's infected, the risk of transmission in that interaction is 1.5%. Okay, so not only is the person who is infected protecting the other person who is not infected, the person who is not infected, if they are interacting with somebody who is infected, even by wearing a mask, they are protecting themselves, because at least by 30% they're reducing the viral load of any particles that are coming their way, which will mean that whatever infection they do get will be less severe. Now, another point again, that valve masks are not for use during a pandemic, because although they filter air coming in, they do not filter your breath going out, and therefore you can infect other people by wearing a mask that has a valve on it. So this is a no-no. Now, there was a question about air travel and how people can safely take flights. Obviously, taking a flight, you are in a closed environment with a lot of people for several hours. So, the positive side of that is in airplanes, they do control how the air is circulated and filtered. And I think most airlines are pretty proactive in giving masks and, trying to maintain distance and wearing face shields. I mean, I personally would wear eye protection as well, glasses, mask, and, be very careful when you use bathrooms, in planes, that you don't pick up the bug through surface contamination, that again, you're very careful about cleaning your hands with your sanitizer, especially before you go to take your meals. But I mean, a lot of people have been traveling, and each place is having their own quarantining requirements when you arrive in that city. And a lot of flights are requiring that people get tested before they actually take flights. But again, a test is only valid the day you take it. Somebody could get positive the next day after they take the flight, for example. So you have to basically, I mean, it's a little bit exhausting, but you actually have to always act as if you have COVID and that everyone else has COVID. And if you behave in that manner and keep up that, alertness, then hopefully we can reduce the risk. And the key is reducing risk. We may not be able to take the risk away totally, but we can go a long way in reducing that risk and improving our chances at, safely navigating this pandemic. Now, there were a lot of questions on cleaning. Now, I'll direct everybody to this YouTube video I made early on, which was on, making up household disinfectant solutions in spray bottle formulations. It's very important. Professor Kumar, you were asking about how we keep ourselves safe at home. people are getting affected because they're not using the right products. They are thinking that they're cleaning properly, but they're actually not. If somebody is infected in your home, for example, then you have to think that your COVID bubble, which looks like this, okay, which is safe, suddenly somebody in your family is infected. Suddenly, your COVID bubble looks like this. You have all these COVID particles floating around in the house and also settling down onto surfaces. Can you see what I'm talking about? So it's very important that high, frequency areas are cleaned, frequently and carefully. And in order to kill the virus, that surface has to be saturated for 10 seconds. And it has to be left on that surface and then wiped off. That's why spray bottle formulations are quite good. And in this YouTube video of mine, I actually go through and actually demonstrate how people can make up these formulations, whether it's methylated spirits or whether it's bleach, how exactly you make it and you keep it safe. And again, keeping it out of reach of children, but equip your house and also think of the environmental impacts of whatever you're doing now. We don't want to create another disaster. That's why, as I said, use reusable fabric masks. Don't use the disposable ones. Use spray bottle formulations. Don't use wipes. Try and think of future implications as well as current, protection. Now, there were a whole lot of questions about vegetable cleaning. Now, again, I would take you back to the biology of the virus. It has a fatty envelope. Now, there has been, food is a very low risk, actually, in terms of transmission. Because if you think about it, whether it be, somebody's prepared some food, that virus can't actually replicate inside the food. The virus needs to replicate inside a human or inside an animal cell. But with vegetables, for example, the person who or sabzi mandiala, or if they were infected and they happen to cough or, touch the vegetables, so theoretically you can have COVID particles sitting on the surface of your fruit and vegetables. So this is what I would do. So I just, when I get my fruit and veg, I just fill my sink with some water, just, normal water, cold water, and put in just a very small squirt of dishwashing detergent and just give the vegetables a good, wash and rub. Then I rinse them very well, dry them carefully and then store them. Now, the same thing can be done with the जो दूध के पैकेट्स और या दही के पैकेट्स जो आते हैं, आप सिंक में कर सकते हैं या वॉश बेसिन में कर सकते हैं उसको धो के, because basically if you are using detergent, it will deactivate any virus particles which are sitting on the surface of those packets. If there are other packets that you would put in from outside, the other thing you can do is remove the outer packaging and then put, whatever the food product is, whether it's rice, into your own clean package. So there were questions about log, namak pani, haldi pani se, ya neem pani se, they're trying to wash, or with baking soda or lukewarm water. I would suggest none of these things work. The only thing scientifically and logically that will work is a little bit of detergent. But again, it's nothing to get to, and again, you have to think, am I actually eating that vegetable raw? If I'm cooking it, for example, if it's an onion, you're going to peel the skin and then you're going to cook the onion. Or some vegetables you're going to peel and cook. So you're removing the outer layer. Just like I said, remove the outer layer of your clothing when you come in. Remove the outer layer, or if you can't and it's an apple that you're going to eat, wash it carefully. So I hope that answers all the questions about that. Now, there were a whole lot of questions about how do I know, is it COVID, is it a cold, or is it a flu? And on this topic, I'm going to get Dr. Vikas Maurya as well to help me. I'll just address what, my answers to these questions, and then I'll get Dr. Maurya's input. Is Dr. Maurya there as well?
Dr. Maurya is busy with some patient. He has just.
Dr. Maurya is busy. No worries. I can also get, is Dr. Shafi available?
Yeah, Dr. Shafi is here. Dr. Singhal is here.
Dr. Shafi. Okay, excellent. So I'll just read out the questions. Is COVID-19 is just like the flu. Is COVID just a mutated form of the common cold? And how do I tell the difference, between a cold and a flu? Okay, and why if it's supposed to be an upper respiratory tract infection, why am I getting also some people getting diarrhea? Why are people also getting tummy symptoms? So these were the questions about, differentiating. So I just want to show this slide, which goes through the various symptoms of COVID. So as I explained, it's an upper respiratory tract infection. Generally, the infected droplet enters through your, your nose or your mouth, and sometimes through your eyes. And we can get any of these symptoms. So we've got dry cough, fever, running nose, yanti सूखी खांसी, बुखार, नाक का बहना, गले में दर्द, breathlessness, सांस में लेने में difficulty, सर में दर्द, जो body ache हो सकता है, sneezing, tiredness, diarrhea भी हो सकता है, और लोगों की sense of smell और taste भी जा सकता है. Now, जब ये virus particles हमारे enter होते हैं, they bind to cells that contain this ACE2 receptor, जो काफी ज्यादा आपके मुंह में होते हैं, नाक में होते हैं, but they are also in, it can be also in your gastrointestinal tract, and that's why you can also get diarrhea, because it depends on, and also obviously in your lungs, in your heart, and various other areas where the virus tries to bind. So as you can see in this chart, there are a lot of overlap, So जैसे कि आपने पहले भी महसूस किए होंगे ये वाले, जो symptoms, जो भी cold या upper respiratory tract आपने, महसूस किया होगा, ये सारे symptoms आपने, देखा होगा. Now the question is actually, the point is, unless you have, जो वो typical जो लोग कहते हैं कि जो loss of smell है, जो loss of taste है, that seems to be very typical of, COVID, which we haven't seen so much in flu and cold. But what I would say is that even if you don't have a fever, if you have any upper respiratory symptoms, you must assume you have COVID, and you must isolate yourself from your family members straight away. जैसे आपको लग गया होगा कि मुझे बुखार है, तो आप, उसी वक्त, you start wearing a mask and you get medical advice and you seek a test. What would you say about that, Vikas, Dr. Singhal? In terms of, and also, Abhi, I'm hearing ki.
So just one thing I wanted to say, that you're very right. Like a lot of people will have this anxiety कि अच्छा कि कोई और वायरस भी हो सकता है, कोविड ही जरूरी नहीं है, क्योंकि और सारे वायरसेस भी हैं ही जो पहले से हमें कॉमन कोल्ड होता था, पेट अपसेट होता था. लेकिन टू थिंग्स टू बी अवेयर, एक तो आपकी कॉन्टैक्ट हिस्ट्री है कि नहीं, अपनी कॉन्टैक्ट हिस्ट्री को जानिए, आप बाहर गए हैं, कोविड बहुत कॉमन है. दूसरी चीज, ज्यादातर जो बेनाइन वायरसेस हैं जिनसे ज्यादा, वो मोस्टली सेल्फ लिमिटेड होते हैं, 2-3 दिन में आपके लक्षण improve हो जाते हैं. Your symptoms will get better mostly for most viruses, the common viruses, within 2 to 3 days. So as Dr. Sandhya said, start taking precautions right at the onset. Don't be casual, isolate from family members. But if your symptoms are not improving within 2 to 3 days, you should not, then now testing is very readily available, and to seek a test early, because don't take precautions early, teleconsult if required. So there is a lot of things, government is also facilitating now the testing. You don't even need a prescription to get tested. So don't leave it for, you can get tested early, start taking precautions early, teleconsult early. Those are some things I want to say.
Yeah. I think that's really good point. And अभी I think dengue की भी season चल रहा है अभी, और मलेरिया का भी, और लोग समझते हैं कि अच्छा ये डेंगू होगा, कोविड नहीं है. बट आई थिंक अभी जो कोविड, जैसे आप कह रहे थे कि इतना फैल चुका है कि आपको अस्यूम करना है कि फर्स्ट थिंक ऑफ कोविड एंड फर्स्ट थिंक ऑफ प्रोटेक्टिंग अपने फैमिली मेंबर्स को, क्योंकि even if you take that precaution, it'll keep your family members safe regardless. One of the good things this pandemic has taught us, it's about infection control and keeping our germs to ourselves. One of the good things, outcomes in a lot of countries, is that the rate of flu virus has actually gone down. And the difference in flu virus, for example, is flu is a rapidly mutating virus. And that's why every year, flu vaccine actually has to change. But COVID, in contrast, is not rapidly mutating. But the point is that if you are sick, isolate yourself and seek medical advice and get tested. Don't assume कि मुझे COVID नहीं हो सकता, क्योंकि even अगर आपको contact history भी नहीं है, जैसे Professor Kumar ने कहा था कि like even by taking precautions, people are still getting it. So so keep a high level of suspicion, basically. Just go. So again, there was another question about, Dr. Singhal brought up the points about testing. Just Dr. Shafi, did you want to have any comments on the various types of tests that are available at the moment in India? That I think people may be confused about, कि कौन सा test कराएं, antibody test या just swab?
All right. Can you hear me?
Yeah.
Yes, perfectly all right.
Yeah. Currently in India, we have got 3 types of testing being done. Like RT-PCR, which is recommended by ICMR. The next test would be a TrueNat test. And the third test is rapid antigen testing. So the first 2 testings, RT-PCR and TrueNat testings, are considered to be a little standard tests, which uses genetic material to check whether the virus is present or not. The third test is the rapid antigen test. It has got little less sensitivity against the detection of antigen. So the point is, RT-PCR takes pretty long time for the reports to come. On an average, if the sample is being kept in the first instance in the machine, it will take at least 8 to 10 hours for the report to come. Comparatively, if we go ahead with the TrueNat, it takes about 3 to 4 hours for the report to come. And if we go ahead with the rapid antigen testing, it will take hardly 30 to 40 minutes for the report to come. As I have told, RT-PCR and TrueNat has got high sensitivity. So these first two tests are recommended for the patients. The third one is slightly, if there is a mass crowd and we really need to detect the testings, then we have to go ahead with rapid antigen testing. If rapid antigen testing is done, if the report is positive, then it is positive. If it is negative, then don't assume it is negative. That's a tricky test. If it is positive, then it is positive. If it is negative, then don't assume it to be negative. So that's a word of caution we have to mind when we are getting a rapid antigen testing done. In this context, like if a patient is having symptoms, then a patient is advised to go ahead and get the testings done. As you have told, have low threshold for suspicion. Have low threshold for suspicion of disease. So if a patient has got any kind of symptoms, whether it is common symptoms or uncommon symptoms. The uncommon symptoms can be, low backache, rashes, headache. These are certain uncommon symptoms, including chest and altered sensorium. The conscious levels will be changed in person to person. So in such instances, it is advisable to go ahead with the testing immediately. Don't wait for a day more or 2 more. If the patient is not having symptoms or somebody at home is affected and his brother or sister also stays in the same family, but they doesn't have symptoms, such patients are recommended to isolate themselves on priority, and then if symptoms develop in next 2 to 3 days, then go for testing. Otherwise, don't go for testing.
Okay, Dr. Safi, further, out of all these three types of tests, is there any research has been done that what is the percentage of authenticity of these three types of tests and what is actually very commonly available within our country?
So we are available with the government of India. The government of India, and particularly in states, they are supplying with rapid antigen tests. But ICMR recommends RT-PCR. TrueNat is little less available. It is usually being seen in corporate sectors and all.
Okay. Okay, just Dr. Sandhya.
Sorry, Dr. Shafi, is this all the ones you're mentioning there, nasal swabs? Nasopharyngeal?
All the three samples, all the three testings will be done by collecting samples from the nasal or oropharyngeal swabs, preferably nasal, if not oropharyngeal.
So what about the role of the antigen testing in the blood?
Role about the antigen testing in blood. Usually people get this testing done after 28 days to check if there are any immunoglobulins which has developed. These are nothing but antibodies. Immune system, once a patient gets affected, the immune system acts against it and develops a fighting mechanism in the body. So to check whether the same patient will get again reinfected or not, whether the patient has developed its immune system or not. So this test is being done to check that.
But not only that, I think there's also implications for plasma donations. Immune plasma donations are being used in treatments in India, as far as I'm aware.
It is still skeptical and critical to say whether the plasma transfusions really help or not. Although we follow in India, in fact, in our capital, Delhi, it is the plasma banks have been opened up.
Right.
But if we see in contrary to India, US, like they have rejected use of plasma therapy. But in India, we still continues to follow because certain studies have shown that it is found to be beneficial in critically ill patients. Patients who are either in ARDS like severe lung diseases or patients who are on ventilator. So in such patients, certain studies have shown that it is found to be beneficial.
Doctor, I have a question to you because I have personally gone through COVID in case of my elder brother.
Yes,
Doctor, when he was admitted for COVID-19 to the hospital, and after that, remdesivir was given to recommended by the doctor, treating doctor, and it was given to him. And after that, symptom was showing that improvement, and later he was put on plasma therapy. That plasma therapy was also given, and it was in the All India Institute of Medical Science. So plasma therapy was also given, and later further he improved and suddenly collapsed. So we got anxiety. What happens and what goes through the patients when such kind of treating a patient for unknown enemies, and we are trying everything. So, what is your take on this? And when the person is going to the treatment to the hospital, 90% of people are getting recovered. So that very strange. Now there is no कोई इसका इलाज नहीं है लेकिन लोग ठीक हो रहे हैं और इलाज नहीं है लोग मर ही रहे हैं. तो बड़ा डायकोटोमी का कॉन्टेक्ट. जी.
All right. It is it's actually a very good question, but it is probably many more people must be having similar questions the way you had, Professor Kumar. So my take on this would be like currently we are using antivirals, and remdesivir comes under antivirals. The way for a bacteria we use antibiotics, the same way for a virus we use antivirals, and remdesivir is nothing but an antiviral. So we are at a junction wherein we are not in a position to take up a call which drug can actually heal, which drug can actually cause side effects. Even if a drug is found to have certain more benefits than risks being involved, we are adopting them. Could it be remdesivir? Could be flavipiravir? So all such antivirals are being put into implementation. That's one thing. And second thing, it is like sequential following up of all the available existent remedies, whatever have been proven or under trials are being used, stating that it is causing no harm to human life. The benefits cannot really be assessed and quantified, but these drugs have been approved stating that they cause no harm to the human life. On those grounds, these drugs have been approved and are into usage. And probably in this particular gentleman who could not be saved, the COVID disease itself has got a typical pathophysiology, which involves the blood gets thickened up. So if the blood gets thickened up, then the viscosity of the blood increases. जब blood गाढ़ा हो जाता है तो खून ठीक से सर्कुलेट हो नहीं पाता है, और इस वजह से क्या होता है, वो उसमें छोटे से बबल्स, क्लॉट्स फॉर्म होते हैं, और वो क्लॉट्स जाकर कभी हार्ट में रुक सकते हैं, कभी दिल में, कभी ब्रेन में रुक सकते हैं. सो दिस पर्टिकुलर जेंटलमैन, इनको आइडियली ऐसी दवाओं पे स्टार्ट किया जाता है जो खून को पतला कर सके ताकि उनका रेगुलर नॉर्मल फिजियोलॉजी चल सके. बट इन सर्टेन इंस्टेंसेस, इन सर्टेन पेशेंट्स ये पॉसिबल नहीं हो पाता है. तो खून उनका पतला होने से पहले ही वो क्लॉट्स अगर घुल ना पाए हों तो इट टेक्स सेकेंड्स ऑफ टाइम कि वो हार्ट में, ब्रेन में या फिर लंग्स में लॉड्ज अप हो जाएं और फिर कॉज एन अटैक. one of the reasons.
Other organs are very well intact, तो उसमें भी होता है, organs doesn't get affected, but despite this it could happen, isn't it?
Yes.
Okay.
This can happen.
Thank you.
You're welcome, sir.
जो सिम्टम्स के बारे में हमने बात किए थे, दो सिम्टम्स काफी वरिंग है और आपको इमीडिएटली मेडिकल हेल्प चाहिए अगर वो एक है शॉर्टनेस ऑफ ब्रेथ और दूसरा है कंफ्यूजन. दिस कंफ्यूजन इज अ वेरी बैड साइन एंड यू नीड इमीडिएट मेडिकल अटेंशन उस सिचुएशन में. एंड ऑब्वियसली जो ब्रीदिंग में है, जो जैसे हमने रेकमेंड किया था, अगर आपको कोविड है, आप टेस्ट पॉजिटिव हैं, तो जैसे मेरे वीडियो में मैंने समझाया है कि मॉनिटरिंग ऑक्सीजन सैचुरेशन एट होम विद अ पल्स ऑक्सीमीटर एंड मेंटेनिंग उसको 95 से 100 के बीच इज वेरी इंपॉर्टेंट, to say कि हाँ, I'm safe. But this, जैसे कि मैंने समझाया कि जो ये वायरस है, it can attach to any of these cells with the ACE2 receptor. That way it can also cross the blood-brain barrier and cause problems in your brain and confusion. So that this is a very important thing to be aware of as well. Now, moving on, just go back to my screen. Is my screen still up?
Just wait, Dr. Sandhya, the presenter role has been changed. Now you are the presenter. Now you can see the screen.
Okay. All right. So I just wanted to talk about, there were a few questions, just like Professor Kumar brought up, and so did Dr. Shafi. Questions we got was, when there is a COVID-infected person in the family advised for home quarantine, how can the entire family manage and take care of the family member and their own safety? And should all the family go for a test and start taking home care? And also, अगर एक फैमिली, दो फैमिली के सदस्य पॉजिटिव हैं और दो नहीं पॉजिटिव है, कैसे मैनेज कर सकते हैं? सो सेम जैसे मैंने अभी बताया आपको कि आपको विजुअलाइज करना होगा कि अब अगर एक बंदा इन्फेक्टेड है घर में, उसको आपको एक जगह में रखना चाहिए, एक कमरे में सेपरेट. They should be isolated from the rest of the family. So just like I demonstrated,
if somebody is infected at home, suddenly you've got to think there's COVID inside.
So जैसे मैंने बताया कि ये जो आपको समझना है कि अब कोविड घर के अंदर है और उसको आपको एक जगह में रखना है, and you want to keep it safe, but that room you want to ventilate it as well, and you want to keep the whole house ventilated. And the precautions that you take, I like to think of it जैसे आपको समझना चाहिए कि वो जो फैमिली मेंबर है वो जैसे एक बॉक्सिंग रिंग के अंदर है, और वो बॉक्सिंग रिंग के अंदर है, और बाकी जो फैमिली मेंबर्स वो 2 मीटर की दूरी से उस फैमिली मेंबर की देखभाल कर रहे हैं, लेकिन वो 2 मीटर की दूरी से, अनलेस ऑफ कोर्स वो इन्फेक्टेड सदस्य एक बच्चा है, इफ इट्स अ चाइल्ड फॉर एग्जांपल, तो उस सिचुएशन में मास्क पहनना इज वेरी इंपॉर्टेंट. वैसे ही इट्स इंपॉर्टेंट इफ यू हैव एन इन्फेक्टेड फैमिली मेंबर एट होम, इट इज वेरी, अगर कोई भी इंटरेक्शन होगा, दोनों द इन्फेक्टेड पर्सन एंड द अदर फैमिली मेंबर मस्ट wear a mask. And if it's a child over the age of 2 and they are under direct supervision, leave it to just one family member की ड्यूटी होना चाहिए उस बच्चे की देखभाल करना, और both बच्चों के ऊपर, and the parent should wear a mask when they are supervised. And that provides very good protection. Now, practically speaking, जो जैसे मैंने बताया कि आपको जो common surfaces हैं उनको आपको very carefully and frequently disinfectant spray से clean करना होगा, और ventilation का ध्यान रखना होगा. आपको if possible उस infected individual को separate bathroom देना होगा, या आपको bathroom को ठीक से ventilate करना होगा after the person has been, as I said, अगर flush भी करना है तो keep the lid down. ये प्रैक्टिकल बातें हैं, they're very important. जो आप खाना देंगे उनको कमरे के बाहर एक ट्रे पर रख के देंगे, आप उनको अलग यूटेंसिल्स देंगे, और जैसे कि आप पानी है जिसमें वो उस यूटेंसिल्स को उसमें धो सकते हैं, रख सकते हैं, ताकि जो अदर फैमिली मेंबर जो बर्तन लेके जाएगा वहां से, they can wear gloves and they're going to be very careful to then clean those utensils. So it's very important. Same जो कपड़े होंगे of the infected person वो अलग से wash होंगे, hot wash होंगे, और आप झाड़ेंगे नहीं वो कपड़ों को, like you're not going to try and disperse the particles, and you are going to try and ventilate the house as much as possible. Okay, so that is how you're going to manage. And as Dr. Shafi said, if somebody in your family is infected, you don't immediately, if you don't, other family members को कोई symptoms नहीं है, immediately आपको test लेने की जरूरत नहीं है. लेकिन अगर आपको symptoms हो जाते हैं, then of course you can go and get a test and it is readily available. But you should take every precaution. ऐसे नहीं सोचना चाहिए कि अरे उसको हो गया अब सबको हो जाएगा, नहीं, क्योंकि काफी लोगों को they have had कि family में एक member को हुआ है और बाकी member को नहीं हुआ है. And at every opportunity, you must protect yourself and take every precaution to avoid and reduce. And in that situation, I would refer to my video. अगर आप सोचेंगे कि आपका risk अब इतना ज़्यादा बढ़ गया है क्योंकि मेरे family member infect हो गया है, then I would be proactively doing the nasal rinsing and gargling. Every family member should be doing it, and every family member should start taking their their vitamin C, their zinc, vitamin D, immune support, क्योंकि ये common sense बात है, क्योंकि अब खतरा हमारे like सामने है, so for the purposes of my management plan, and this now leads on, or just one more point, एक question था breastfeeding का. अगर एक breastfeeding mother या pregnant mother infected है, तो again same precautions you are going to take. If you are pregnant, you are going to be even more careful, especially in the last trimester of pregnancy, कि आप बाहर नहीं जाएंगे, like you'll stay at home as much as possible. जहाँ भी जाएंगे आप मास्क पहनेंगे, क्योंकि जो ज़्यादा risk है वो getting infected just at the time of delivery, because there has been cases, a few cases, not many, where the infection has gone, vertically to the baby as well. तो ये आप avoid करेंगे. अगर breastfeeding mother को infection होता है, तो आप it is very important that you continue breastfeeding, लेकिन आप mask पहन के breastfeeding कर सकते हैं. You avoid touching the baby's face. You wash your hands before touching the baby's face. But breastfeeding बहुत important है continue करना, क्योंकि ये बच्चे की immunity के लिए बहुत important है. So yes, it is safe to breastfeed, and masks again are very important. And again, that common sense, don't touch the face. Try not to. Those virus particles are only damaging when they enter your body, when you allow them to enter your body. So that is what has to be avoided. So from there, I just want to move on to, there were quite a few questions about immunity, and I'll get Dr. Singhal's help with this one. So on the basics of, जैसे मैंने कहा था अपनी वीडियो में, जो आपका सबसे important defense mechanism in fighting any infection is हमारी खुद की अपनी immunity. और उस immunity को prime रखने के लिए ये important है कि हम सब healthy diet लें, और उसमें जो whole foods हमको खाने चाहिए, जैसे कि जो हर एक रंग की जो फल सब्जियां हमको खाने चाहिए, और हमको जो processed foods हैं उनको बिल्कुल avoid करना चाहिए, जैसे कि ये नमकीन्स या snacks या मैगी जो पैकेट में से निकलते हैं, ये processed foods कहलाते हैं, और जो alcohol और sugary drinks. We need to keep well hydrated with water. हमको अच्छी 8 घंटे की नींद लेनी होती है रात को, and we must stay calm. You must stay positive. Now there are a lot of questions about जो लोगों की chronic health conditions होती हैं, जैसे कि diabetes, asthma वगैरह. And yes, it is very important कि हमें if you do have a chronic health condition that you you stay on top of it. जैसे अपनी sugars को आप control में रखें, जैसे कि अगर आपको asthma है, आप अपनी जो preventer medication है, you take it regularly ताकि आपको wheezing नहीं हो रहा है daily basis पे, क्योंकि you want to be in peak condition. Now the immune supplements I talked about were zinc, vitamin C and vitamin D. जो जिंक और विटामिन सी मैंने रेकमेंड किया था वो सिर्फ उस टाइम जब आप इन्फेक्टेड हैं. जो विटामिन डी का बात मैंने किया था वो इसलिए किया था क्योंकि विटामिन डी इज वेरी इंपॉर्टेंट फॉर इम्यूनिटी, एंड इट इज ऑल्सो it's very common कि इंडिया में लोगों को vitamin D deficiency is almost 80 to 100% of people have vitamin D deficiency in India, and so it's very important that we make sure we maintain a good vitamin D level throughout this pandemic, basically. Now, just to quickly go through jo underlying conditions that are strongly associated with increased risk of severe COVID, ये जो serious heart conditions होते हैं, जैसे कि coronary artery disease, heart failure, chronic kidney disease, जो chronic obstructive pulmonary disease होता है, type 2 diabetes, obesity, cancer, and immunocompromised states. Now, out of all of those, actually one of the most important ones is obesity. जो जिन लोगों में body mass index greater than 30 होता है. So that is something I would encourage you to work on, reducing your weight and bringing yourself into a healthy weight range, through good diet and exercise now, when you are not infected. And I'll get Dr. Singhal's input on this as well.
Sure. Just a minute before you start, Dr. Singhal, Dr. Maurya has also joined. He was in ICU right now, and he has just joined us in his inform. So go ahead, Dr. Singhal, please.
So yes, like you said, so we have to be ready to fight this disease. We don't have a lot of treatment, but to be able to fight this disease, we have to make ourselves strong, as in our immunity strong. And so how we make our immunity strong is that we make sure that our chronic medical diseases are well controlled. So going into the disease, if supposing we are going to contract it, we don't want that our sugars are already high, our diabetes is not well controlled, our weight which can be optimized. सो हमें जानना हो चाहिए कि हमारी हाइट के हिसाब से हमारा वेट कितना होना चाहिए, हमारा आइडियल वेट कितना होना चाहिए। इट इज बीएमआई कैलकुलेटर्स फोन्स पे अवेलेबल होते हैं आज, कोई आप ऐप डाउनलोड कर सकते हैं, बीएमआई कैलकुलेटर देख सकते हैं अपना बीएमआई। सो इट इज वेरी इंपॉर्टेंट कि हम आज से ही ये प्रिकॉशंस लेने शुरू करें, जिससे कि कल को अगर हमें ये डिजीज हो भी जाता है तो हम उसके लिए तैयार हैं, हम उसके लिए रेडी हैं। Today is the time to change our diet, and even if we have been obese for a long time, it doesn't matter, we have to start somewhere. So today is the time to start because we are facing a pandemic. uh, how you can start is that what commonly in our Indian diet, the main problem is the high carb load. We take a lot of emphasis on roti, rice, meetha, namkeen, bread, biscuit, snacks, processed foods, juices. There's a lot of emphasis on it. What our Indian diet typically lacks is proteins. We a lot of, a good chunk of the population is vegetarian, don't even take eggs. So it's very important that in every meal we try and take two sources of protein. चाहे आप दाल दही लें या पनीर लें, चने, एग लेते हैं एग लें, एक दो हफ्ते में एक दो दिन अगर नॉनवेज लेते हैं उनमें। So it's very important to change our diet at this point of time and start managing our obesity now, even if we have not done it so far. So diet is one aspect. It's, like you said, eat healthy. Lot of increase the proportion of fresh fruits, vegetables, salads. We are anyway now cooking at home, also not eating from outside. Eat timely. Don't do your body timely, and exercise. That is, of course, the other more important thing. That generally, if you're wearing a mask in an open environment, it is safe. A lot of my patients ask me, आजकल मैं walk नहीं कर सकता, लेकिन ऐसा नहीं है। आप मास्क लगा के एक ओपन एनवायरनमेंट में इसको कॉन्ट्रैक्ट करने का रिस्क बहुत कम है अगर आप प्रिकॉशंस के साथ जा रहे हैं। कम से कम आधे घंटे का रूटीन, हाफ एन आवर 5 days a week, जो एक हेल्थ मेंटेनेंस के लिए WHO का रिकमेंडेशन है कि if you can just put in that, start doing that change, you will realize that you don't have to lose too much weight. Even losing as little as 5 to 10 kg weight can actually really start improving your health conditions, your immunity, improving your sugars. If you are diabetic, it will improve your sugar control. So this is the time to start addressing your chronic health conditions if you have not paid a lot of attention to them so far, because we know we don't have a lot of treatment at this point of time. So all we need to manage our obesity. We lot of the patients who are getting hospitalized or getting to the ICU or dying from COVID are more who are obese or who are diabetics. Actually, if you're diabetic, the risk of dying from it is 6%, not the 2% that is the general fatality rate in India. So I cannot emphasize more that most people will recover from it, but you don't want to be in that 10-20% who needs to be hospitalized. So work on your health prevention at this point of time. अपनी chronic medical disease को अभी से address करना शुरू करिए. So you can add on something, Dr. Sandhya, to that.
Absolutely, Vikas. The other thing I'd like to add, actually, there's a Dr. Asim Malhotra who is actually from Delhi originally, and he's a cardiologist, a leading cardiologist in the UK. And he has led the fight there because a lot of the morbidity or the death that happened in COVID in the UK was due to obesity. So he has addressed this as a priority, and he has actually just written and released a book called the 21-Day Immunity Plan. And he believes that even in 21 days of changing your, your diet and your lifestyle, you can significantly improve your immunity. And I think that's key, because I think that लोग सोचते हैं कि अब अब ये इनसरमाउंटेबल प्रॉब्लम है, मैं कभी इससे बच नहीं सकता, ये जो ओबेसिटी की जो इश्यू है। लेकिन ऐसी बात नहीं है, क्योंकि 3 हफ्ते के अंदर आप काफी डिफरेंस देखेंगे अपनी हेल्थ में, अगर आप ये सीरियसली लेंगे। और मैं ये एडवाइस दूंगी कि मैं ज्यादातर पेशेंट्स को जो young, that they're not taking too many medications, या आप डायबिटिक भी हैं, अगर आप दिन में 2 बार मेटफॉर्मिन भी ले रहे हैं, then I would highly recommend looking at the intermittent fasting, जो 16 and 8 डाइट है, जिसमें आप दिन में 16 घंटे के लिए आप फास्ट कर सकते हैं, और सिर्फ एक 8 घंटे की विंडो के अंदर आप खाते हैं, लाइक जैसे कि 12 दिन दोपहर की 12 बजे से रात के 8 बजे तक। एंड इफेक्टिवली उस टाइम में आप क्या करेंगे कि आप दिन में 3 मील नहीं, लेकिन आप 2 मील खाएंगे। और ये एक मिसनोमर है कि ये एक गलत फहमी है कि जो ब्रेकफास्ट है, ये जो नाश्ता है, ये सबसे इम्पोर्टेंट मील है दिन में। ये दिस इज नॉट करेक्ट। ये जो केलॉग्स ब्रेकफास्ट कंपनी ने ये मार्केटिंग के लिए गलत फहमी basically फैलाया है। The point is that we don't actually need that much food. Body needs to have some time. You need to feel hungry before you actually eat. अगर आप वैसे ही खा रहे हैं, then until you feel hungry, your body will not utilize any of that stored energy, and you will not lose weight. So exercise makes you feel better, and it's very good for mood, but reducing the quantity of what you are eating and looking at the quality, जैसे डॉक्टर सिंघल ने बोला है कि कार्ब्स कम करने, और ये जो सारे प्रोसेस्ड फूड्स कम करने हैं, और शुगरी ड्रिंक्स, और ज्यादा एम्फेसिस जो प्रोटीन और जो होल फूड्स, जैसे कि मैंने कहा था, फ्रेश फूड्स। So that's all I wanted to add. Don't give up hope. This is your biggest defense mechanism. आपकी खुद की अपनी इम्यूनिटी आपकी सबसे इम्पोर्टेंट डिफेंस मैकेनिज्म है इस इन्फेक्शन को फाइट करने में। और ये एक मैराथन है, ये एक शॉर्ट टर्म स्प्रिंट नहीं है। तो ये पैंडेमिक चलता ही रहेगा, तो हमें अपना we have to maintain good health basically.
Dr. and to all the doctors who are panelists, जैसे अभी आपने बताया कि डायबिटिक हैं और उनको इंटरमिटेंट फास्टिंग को पे जाना चाहिए, तो एक मिसनोमर ये है या एक फियर है कि इफ यू डोंट टेक फूड ऑन अ रेगुलर इंटरवल्स, प्रॉब्ली फिर हाइपोग्लाइकेमिया हो सकता है, जिसमें
नहीं हो सकता है। सॉरी, I'll interrupt you.
Yeah, please.
प्रोफेसर कुमार, जो ये गलतफहमी होती है ना, क्योंकि लोग डिफरेंस नहीं समझते जी टाइप 1 और टाइप 2 डायबिटीज की। जो टाइप 1 डायबिटीज है, जिन लोगों में इंसुलिन नहीं प्रोड्यूस होता है, जो लोग इंसुलिन लेते हैं, उनमें हाइपोग्लाइसीमिया हो सकता है। जिन लोगों को टाइप 2 डायबिटीज होता है, वो इसलिए होता है क्योंकि उनकी पैंक्रियास इंसुलिन प्रोड्यूस करता है, लेकिन वो इंसुलिन की सेंसिटिविटी काफी नहीं होती है, ताकि वो जितना लोड इन टर्म्स ऑफ जो एनर्जी, जो फूड जो अंदर जा रहा है, इट इज नॉट सेंसिटिव इनफ टू डील विद दैट लोड। तो जो मेटफॉर्मिन, जो ऑरल हाइपोग्लाइसेमिक्स जो ये सब लोग लेते हैं, ज्यादातर लोग इन्हीं दवाइयों पे है, ये दवाइयों से आपको हाइपोग्लाइसीमिया नहीं होता है, सिर्फ इंसुलिन लेने से होता है। तो आपको I'm saying कि जो जनरल पॉपुलेशन जो एंड अगर आप डायबिटिक है और आप दवाई ले रहे हैं और आपको इंटरमिटेंट फास्टिंग करना है, तो आप जरूर अपने डॉक्टर से बात कीजिए और अपने लिए टेलर्ड एडवाइस लीजिए। लेकिन जो बाकी जो काफी सारे लोग हैं जिनको ओबेसिटी है, उनको कोई कंडीशन नहीं है, और कोई दवाई नहीं ले रहे हैं, बस ओबीस है। और ये बच्चों में भी है। नॉट दैट आई एम सेइंग कि बच्चों को फास्टिंग करना चाहिए, लेकिन आपको देखना चाहिए कि अभी सब लोग जो लॉकडाउन में है, हमारी जो मूवमेंट है काफी रिस्ट्रिक्टेड है, तो उसी हिसाब से हमें अपना इनटेक भी कम करना चाहिए, क्योंकि it is energy in and energy out. You can't have more energy going in than that is going out. I mean, do you have any
लॉकडाउन में फूडीज हम लोग ज्यादा हो गए हैं, बनस्पति एक्सरसाइज ओरिएंटेड।
Yeah, exactly. And we have to be very careful. And this is incredibly important. ये बहुत ही practical and बहुत ही important चीज है, क्योंकि as I said, इस pandemic के दौरान हमें दूसरा pandemic नहीं चाहिए. हमें ऐसा नहीं चाहिए कि इस pandemic में सब लोग ने घर में बैठ के जो खाना खाया है ज्यादा और एक्सरसाइज नहीं किया है, और जब ये पैंडेमिक खत्म होगा तो हमें एक और पैंडेमिक होगा, जो डायबिटीज, जो हार्ट डिजीज, जो that will be the second pandemic. It is, we must prevent all of it, and this has been an opportunity for every single person to think about what their priorities are. And without health there is no wealth. अपने health पे काम करो. This is the biggest lesson of the pandemic, कि हमारा अपना health हमारा सबसे important strength है. So, diet is very important, and immunity is key in fighting any infection, and and in our quality of life, basically. So there was a few questions about the actual vitamins and the doses, and people were asking, can you overdose on vitamins? Now, except for vitamin D, A, D, E, and K are fat-soluble vitamins. The rest of the vitamins are water soluble. So अगर आप vitamin C भी लेंगे तो आपको, you can't really overdose on that, क्योंकि वो आपकी kidneys will get rid of that. But you have to be careful that you are not overdosing, obviously, on vitamin D. As I said, most people in India are deficient in vitamin D, and you need to seek medical advice and take the adequate dose. जो zinc है, again, those advice is commonly available, and जब अगर आपको infection होगा, जब आप medical advice लेंगे और वो script आपको देंगे, वो doctors बताएंगे आपको या supply भी करेंगे कि क्या dose आपको लेना चाहिए vitamin C और zinc के. जैसे मैंने कहा था कि वो जो मैंने दूसरे vitamins की बात की थी, वो सिर्फ जब आप infected हैं तब. जब आप infected नहीं है तो आपको अपने खाने के थ्रू आपको adequate vitamins लेने चाहिए, और आपको अपनी डॉक्टर से personalized tailored advice लेना चाहिए इस बारे में. So that's on vitamins. So next, after that, I just wanted to go, there was a question about does rinsing the nose protect against coronavirus? और जैसे मैंने कहा था कि rinsing nose, जैसे ये एक respiratory droplet virus है जो enter करता है, और सारे जो studies आ रहे हैं वो ये इस बात को prove कर रहे हैं कि viral load is important. So it is important कि अगर आपको लगता है, जैसे कि मैंने अभी बताया कि आपकी फैमिली मेंबर को हो गया कोविड, तो आप प्रोएक्टिवली अपना नाक रिंस कर सकते हैं, और ये बिल्कुल सेफ है और ये लॉजिकल भी है, और इससे आपको जो भी वायरस पार्टिकल्स आपके नाक के अंदर है उससे आपको कम हो जाएंगे. So there's also a misconception कि हमको पता लगता है कि हमें कोविड नहीं है अगर हम अपना ब्रेथ 10 सेकंड के लिए बिना डिस्कम्फर्ट के लिए होल्ड कर सकते हैं. और डॉक्टर मौर्या, मैं आपसे पूछूंगी, you can answer this question.
No, this is yeah. First of all, I would like just apologize. I was in the COVID ICU today, so now thanks. So this is about about the question that whether holding the breath for 10 seconds. I think it's just a misconception. It doesn't fit in, because it depends upon your own ability to to hold the breath. People who do regular exercise, people who are doing regular I mean they're with whether they're gym or whether they're yoga, they can hold the breath even for longer than that. So with corona, we never say that that if you hold the breath for 10 seconds you will not have corona. I think it's an infectious disease. You can know only by way of testing it, and if you have the symptoms, and then if you can do if you do the test, then you can know that you are having the symptoms, because lung involvement is not there in the cases. Only in the in the milder cases you not have the lung involvement. So in that cases you may have may hold the breath, but you may have the milder form of the disease. So that's you have to understand.
Yeah, and there was also another question about is practicing yoga and pranayama good for detoxing lungs? And the other question about breathing was, how can people who already suffer from breathing illnesses, जैसे asthma होता है या bronchitis, उनको कैसे पता चलेगा कि उनकी breathing issue asthma या bronchitis की वजह से है या coronavirus की वजह से है?
See, first of all, like like doing yoga or pranayama, what I say is that I mean, these things does help in improving your lung functional capacity. For example, everybody have their own lung function. For example, asthmatic will have their low level of lung function, and the normal individual, they have their own normal lung function. So when you do these exercise like yoga and pranayama, basically you're improving your lung capacity at that particular function level. So so that would happen, for example, when we do exercise or something like yoga. So when you start doing, for example, if a person who is most of the time sitting, and having a, at a job, most of the time the sitting job. So if they start running, they will feel breathless. But when they start doing these, the cardio exercises like, cardiorespiratory exercises, including, yoga and pranayama, they will have improvement in their lung function. I mean, in their lung functional capacity. So at that function, they will have more capacity to do the work. So that what even the yoga and pranayama does. It improves your capacity at that particular function level. You can do more work with that particular lung function. So yes, it does, but I will not use the word detoxifying. I will use the word improvement in the functional capacity.
Exactly.
The second question which you said about the perceptual symptoms in asthmatics or bronchitis. I mean, for example, if they have a milder form of the disease, asthmatics usually have, they have intermittent cough, or they have nighttime cough. Asthmatic, they have, allergic sort of cough, for example, when they are exposed to dust or smoke or pollution, and they have associated wheezing, whistling sound coming from the chest, and they also have, these wheezing associated with breathlessness. But here in this case of coronavirus, I mean, the cough will not be like what we have in the asthma. For example, they will be persistent. If there is a lung involvement, then they will have the cough throughout the day without any, and it will be a spontaneous cough. For example, whenever they are speaking, whenever they are laughing, whenever they are doing, they will have cough. Apart from breathless, most of the time that we have found these coronavirus patients, when they have involvement of the lung, they don't feel much breathless. They have sets of around 92 or even less than 90, and they are just normal. They are just normally. So it becomes difficult for these group of patients. If they already have breathlessness, then whether they have the moderate form of a coronavirus disease or not. But yes, if they have an increase in the symptoms, if they have fever, if there increase in the cough, and which is occurring without any wheeze and without any whistling sound, or they have a new onset of symptoms like they have a stable disease, stable asthma, they are on a stable drugs, and now what they're finding is that they're having an increased symptoms associated with fever, some sort of febrile illness. Then I think they should think of having at least in this pandemic time. Yeah.
Okay. Yeah, that's great. That's great and answers those questions. And I would also say those other exercises. So basically, yoga and pranayama are all focusing on forced exhalation, and which is very good for emptying the lungs. And they are also simpler forms of the exercise in my video, like blowing the balloon or blowing bubbles through a straw in a glass of water, are also very simple ways to do breathing exercises to improve lung function, and this will help anybody, and anybody can practice them now. And I would encourage people who do have bronchitis and asthma to proactively do lung exercises to improve their lung function, and they won't cause any harm.
Dr. Murya, and also Dr. You are saying, Sandhya, before February, everything was not related to COVID. Whatever the symptoms we were facing, whether it's a cold or the cough and all. But after the February, every symptom is happening to us that is getting related with COVID first. So the dilemma of the individual, how a person can be confident or can be go for the advice of the doctor. Because now everything, even if you do not facing any problem, but you're still facing some kind of a short जिसमें कमी लगती है तो लगता है कि कुछ कोविड तो कैसे इसको समझें, एक आम आदमी कैसे समझ सकता है इसको कि अब फरवरी के पहले सारे सिम्टम्स अलग चीजों की थी और फरवरी के बाद सारे सिम्टम कोविड से रिलेटेड?
नहीं, मैं ये दिस इज अ वेरी इंपॉर्टेंट क्वेश्चन, और मैं ये कहूंगी कि it's, I mean, unfortunately, it's even in New Zealand, we have quite low rates of community transmission. लेकिन फिर भी हम ये कहते हैं कि जैसे कि हमारे practice में nobody is allowed to enter the practice premises if they have any cold symptoms. उनके consultation सिर्फ phone के ऊपर होता है या virtually, क्योंकि हम ये risk लेना नहीं चाहेंगे कि अगर उनको COVID है कि वो किसी और patients को they give that symptoms, but most of them obviously just have a cold or a flu, क्योंकि यहाँ तो we just finished winter, अभी इंडिया में winter आया ही नहीं है. But I think the important thing to think about is first of all, if you have even a slight cough or sore throat, don't panic. Follow the steps in my video because it's relevant to जो मैंने management plan दिया है वो that has relevance to any upper respiratory tract infection. और फिर आप अपना like see for a day कि क्या हो रहा है, फिर आप if the symptoms are progressing, you will know within a day or two you will know the difference. And even if you don't, seek medical advice. जैसे Dr Singhal ने कहा था कि अब it's easy, even you can get a test easily, आप virtual advice ले सकते हैं. अगर day 1 पे आपको लगता है कि मुझे पता नहीं है, panic होने में like it's not going to help your immunity. What happens when you panic is that you are in a state of fight or flight, okay? And that is very bad for your immunity. और अगर आपको infection है, assume कि अगर like that it is COVID. If it is COVID, the worst thing you can do is reduce your immunity straight away. So I would say कि this is the reality now. जो January से पहले और जो अब की reality दोनों अलग है. अब हम एक pandemic में हैं और अगर आपको upper respiratory tract की कोई भी symptoms हैं तो पहले आप अपने आप को isolate कीजिए अपने family members से. And that is one rule. और आप बाहर मत जाइए. Please do not spread the infection, okay? Because that's making it worse. So stay home, stay calm, take precautions, जो common sense वाले precautions है. आप हल्दी दूध लीजिए, आप gargling कीजिए, आप steam लीजिए, आप like multivitamin लीजिए, आप zinc, vitamin C लीजिए, लेकिन आप panic मत कीजिए, please. क्योंकि it is basically जो steps हमने बताया है अपने वीडियो में और जो जैसे मैंने discuss किया है कि जो differences हैं जो like between cold and flu, कि अब इंडिया में भी you can get medical help. Okay, so the important thing is don't go out, don't share the bugs, and just wait and see kya ho raha hai, but start doing these proactive, simple things straight away. Assume ki acha COVID ho bhi sakta hai, So yeah, that's it. Did anybody else want to add any points on that?
I just want to say, the question that, now every symptom is being associated with corona. Yeah, we are seeing the patients coming with, apart from respiratory symptoms, patients do come with diarrhea, fever, and they are diagnosed as a corona. The patients are also coming as, with heart attacks, MI, they are diagnosed as corona. People are also coming with stroke. So, corona is, majority of the patients will have respiratory, attack, but it also affecting other organs also. So, at the moment of pandemic, whoever patients, coming with predominantly respiratory symptoms, or maybe gastric symptoms, maybe heart attacks, or maybe stroke, we are doing, coronavirus testing because what we found that it causes multi-organ involvement as well. So yes, majority will be the respiratory one, but yes, you do have other organ involvement as well, and that's why in pandemic we are saying that if we are having symptoms suggestive of the corona, or like we have to do the testing. Yes, so before Feb or March, the symptoms were different. Now in the pandemic we have to be extra cautious and we have to take care about it. Yeah, thanks.
So just another, we'll move on with the questions because we still have a few to cover. So this is again for Dr. Maurya. So there were a couple of questions is that sometimes people, remain asymptomatic, but after a few days they suddenly decline and may require, hospitalization and aggressive antiviral and antibiotic therapy. So obviously these questions are related to hospital care. Another question was, what are the steps to follow if someone older in the family is having breathing problems and needs to be admitted immediately, and concerns about difficulty finding a hospital bed? And also there is a question about the use of hydroxychloroquine. So if you can cover those questions. So obviously concerns about, hospitalization necessity and also some of the treatment modalities that are taking place.
See, yes, as has been said, many times that around 85% of the patient will have milder form of the disease and maybe asymptomatic also. See, majority of the time what we found that these asymptomatics, they goes on, if we don't test them, they goes undetected. But those who are, you can only detect them when you are doing the contact tracing, right? And then you are testing them and you're finding that they are having a disease and then you are isolating them. Those who are tested having the symptoms and having the milder form of the disease, they can, as I said, they can be treated easily at home. Those who are having just upper respiratory symptoms, maybe your throat related, or maybe your fever, cough, or maybe milder form of the cough, and having a sore throat, headache, body ache, or maybe the nasal symptom, they can be treated at home very easily. So what we always advise the patient is that you have to aware of the alarming signs and symptoms. For example, if you are having persistent fever more than 100°F, for more than 2 days or 3 days, not coming down, and it's your second week, right? So it's the second week when you're having a fever not coming down, then you might think that it might be involving the lungs, or you may be having the cough, which is persistent, and you are not able to sleep, and then you are having a breathless, or maybe nowadays we are advising everybody to have pulse oximeter for saturation monitoring. So if they're having oxygen level going less than 95, or maybe having a diarrhea not improving, maybe having a mental confusion. So these are the alarming signs when they have to think of getting hospitalized. So they have to contact at that time. So when they get hospitalized, mainly usually though we consider them as a moderate form of the disease. For example, having saturation less than 95 but more than 90, they considered as a moderate form of the coronavirus disease and involving the lung. And if you do the CT chest of these patients, then you will find the ground glassing, the peripheral, the classical presentation of coronavirus disease. So
can I say something that you can respond? Very importantly, you are what kind of symptoms to be observed. When we say that 95% or 90% people, affected people get recovered, and maybe 10% or 20% they succumb. The coronavirus virus itself has a different characteristics which affect badly to someone, and someone, as you are saying, mild, and some are severe. So how that individual can think of कि मेरा severe है या characteristic of high order of virus है, virus लोग ज़्यादा है.
For example, as I said, if you're having a milder symptoms, which I have already told you, then you are having a milder form of the disease. And when you started having, for example, if you are having, breathing difficulty, as I said, persistent fever or cough, or maybe persistent diarrhea and mental confusion, maybe having the the CNS involvement, or maybe having the heart attacks, due to the coronavirus, then you are into a moderate to severe form of the disease. So these are the patients who need hospitalization. Plus, as said, I think most likely has been explained about the high risk individual. Like we have said, the elderly, those who are diabetics, those who are hypertensive, those who are heart failure patients, kidney failure patients, liver failure patients, immunocompromised. And these transplant patients, these patients are very, very important. They are high risk. So those who are high risk group patients, and if they're having even slightest of the symptom, is a thing that they are not improving at home, they should get immediate, they should get admitted early. You might admit, even when the stats are just below 95, because you don't want to because in them, the disease spreads very, very fast. Have of them bit early because it will not give time. For example, we have seen the mortality is high in diabetics, mortality is high in heart failure patients, they are high in kidney failure patients, in liver failure patients. So that's why these are the high risk individuals. And also the elderly. They use, so these people have to have utmost the sense of responsibility by the family members, and also they should take early consultation by the doctors so that they can explain about so that they can have their disease their comorbid disease under control. For example, their diabetes should be controlled, their hypertension should be under control. So there and that's why it's become very important. So whenever they have they're diagnosed as a coronavirus, even in the milder form of the disease, they should be in consultation with the doctor so that they can have appropriate treatment, and they can explain them the warnings, symptoms and the warning signs where they should go and get themselves admitted.
Sir, can you repeat the question because your mic was muted?
Sorry?
Can you repeat the question? Your mic was muted.
Okay, what I'm saying is that the Arogya Setu, which has been a biggest kind of a application which Government of India has made, and people who are hypertension and also having diabetes, and when they are putting into that, they are the answer which is coming, you have a mild risk or lower risk. They stay at home. This is a suggestion which is coming. Do you think that Arogya Setu has to be redefined itself that on the two parameters, or it is okay?
No, I mean, yes, for example, yes, if a patient who are high risk category, then obviously they are advised to stay at home. I mean, in the pandemic time, for example, if they are not, I mean, they are not supposed, they should not go outside. As I said, these high risk individuals, unless and until it's a very, very important, they have to visit the hospital or they have to consult the doctor. I don't think that these, the high risk individuals at least should go out. And so there should be an advisory by the Arogya Setu app that that these patients should be advised at home, because that is what we are seeing. For example, even right now in ICU, I have majority of the patients or the mortality is high in those who are having these form of the disease, these comorbidities. So yes, so these individuals have to take utmost care.
Huge advising that is a milder risk. Stay at home, but milder risk. So this is a contradictory, no?
No, I think yeah. I mean, they should be shown that you are at a high risk, but you should stay at home. Yeah, that should be the for these high risk individuals. Yeah.
Okay, thank you so much.
You might.
Am I back on?
Yes.
Yeah. So then there were quite a few questions. Oh, you didn't cover, sorry, Dr. Maurya, about there was a question about hydroxychloroquine. Is that being used?
Yeah, I mean, for example, in India, as per Ministry of Health and Family Welfare guidelines, the HCQS is being used for the prophylaxis, and I think many of the healthcare physicians and healthcare professionals, and even other people who are in the front line, they are using the HCQS as a prophylaxis. And for example, since March or April, the guideline came and people are using it. Apart from that, they are also given the guidelines regarding the usage of HCQS in the moderate to severe form of the disease. So this is being used at the moment. Earlier, they were used along with azithromycin, but right now, at the moment, as per guidelines, they are being used along with HCQS is used alone. Not azithromycin is not used for the moderate to severe form of the disease. Apart from this, we are also, I mean, if you ask me the antivirals, investigation therapies like remdesivir or the favipiravir, these are also being used in coronavirus treatment in the hospital, along with obviously as we said dexamethasone, and along with like plasma, and also these are also being used like tocilizumab or other therapies for treatment of these patients.
But they're also using some of these like ivermectin and azithromycin and doxycycline being prescribed to patients virtually through home quarantine as well, I understand. Certain,
I've seen prescribing ivermectin 12 milligram once a day for 3 days, along with doxycycline for 5 days, or maybe just ivermectin 12 milligram stat dose. I think this was because of the Bangladesh, the study which they told about their benefits about that. But usually, what I have found that they may work in, for example, in the milder form of the disease, but if they're going into the moderate form of the disease, it doesn't work. So maybe those who are at home, you may give them, people are giving it. But I think we need a much higher, the studies, more randomized control studies to find out about the effect of ivermectin with doxycycline. I think the studies are going on at the moment. So,
Yes.
Those results of that. But yes, it is being used, at the moment I have seen a lot of prescriptions for the milder form of the disease, ivermectin and doxycycline.
Yeah, I think the validity of bringing up that point is if we're looking at a pandemic where a disease is 80% being treated at home, then it's important for people to know that there are prescriptions, there are, and therefore it is important, and that these medications that although they are undergoing trials at the moment, and as Dr. Shafi mentioned, a lot of the medications or treatment modalities that are being used, whether it be an antiviral, don't cause harm. But we don't know yet whether they're actually causing benefit. But the point is that they are most effective if they do have a benefit, if they are introduced early in the infection. So it is very important to seek medical advice early. Just as I said in my video, please seek medical advice early. Stay home and do all the steps, follow all the steps to try and prevent the infection becoming severe. But don't wait until it's become severe and that you have to be admitted to hospital and only then seek medical help. So that's the relevance of, what I wanted to bring up there. Now, the next lot of questions were about post-recovery. And somebody asked is, if I was COVID-19 positive for 9 days and I recovered, is there any possibility I can pass COVID on to others? And what precautions should I take? And also just generally, what are the precautions to be taken for COVID patients post-recovery, and also the chances of reinfection and reduction in life expectancy? So just from my point of view, I had showed a slide last week, which, you tend to, you're most infectious in the first week of the illness. I think Dr. Maurya will agree. People tend to be infectious for 2 to 3 days before coming out in symptoms. But it's thought that you are not really infectious up till after day 10, or up to 72 hours or 3 days after all your symptoms have settled down, whichever is the later. Is a good sort of way for you to say that, okay, I'm no longer infectious and I'm safe. But, it's probably a good idea to do a full 14 day, or even if you want to do a little bit longer, quarantine from your family members, because what's going to happen? Maybe you'll watch a little bit more Netflix, maybe you'll be a little bit more bored, but you would have protected your family as much as possible, and that is very important. I would say with COVID-19, always err on the side of precaution, and don't give the virus the benefit of the doubt, is what I would say about that. In terms of reinfection, I think I covered that. In terms of even if you do develop antibodies, they don't know how long those antibodies actually last. It can give you protection for up to 3 months, possibly longer, hopefully longer. There have been cases now documented of reinfection with a different strain of the virus. And fortunately, so far, the infections that have come up are less severe or asymptomatic. But again, it's an evolving science. We don't know. And 10% of individuals are getting a condition called long COVID, where they are having persistent symptoms for more than 3 weeks. And for some of these people, they could have been fit and young and healthy beforehand, yet they are still having long-term problems, whether it be some people have developed epilepsy, heart conditions. So yes, definitely it can have a huge impact on the rest of your life. So even if you're young and healthy, the point is that you need to avoid getting infected, because only luck is going to determine whether you're going to be one of those people. Nothing else. It's just luck. So yeah, did any of the other, Dr. Maurya, did you have anything to say about that?
Yeah, just to say that, for example, the positivity, for example, the milder form of the disease, we say that, that after 10 days, you are not infectious and usually recovers in 14 days. So I think that's true for the milder form of the disease. Whereas those who have the moderate form of the disease and who are getting admitted in the hospital, so they may be positive even after the 14th day, Say we say for them, they may be, and for those who are having a severe form of the disease, they may be positive even after 3 weeks. So whenever patients were getting admitted for the moderate form of the disease and they are discharged, we advise them isolation for 7 to 10 days, For example, if we are not testing. And if you are testing in the severe form of the disease, again, we again advise them, 7 to 10 days of isolation. So that would become important when you're getting admitted in the hospital. So in India, as per the guidelines, we are not testing for the mild to moderate form of the disease, So even the moderate form of the disease, when they are admitted, the discharge, you may not do the test. And for these patients, you advise them home isolation for next 7 to 10 days. So that's become important here.
Yeah, that's a good point.
Dr. Sandhya, I
yeah.
have something to add on it.
Yes, please.
Of the people who are infected with COVID, there's only 30% of the individuals who are actually developing the antibodies, whereas the 70% of the individuals remains on the other side who don't develop the antibodies. That means those 70% of the individuals are likely to get contracted again. As such, we do not have strong evidences suggesting that there is a reinfection of cases, but here and there, 1 or 2 cases have come up wherein there is an evidence of, reinfection again in the patient, especially in the healthcare system.
And that is basically a very good argument against herd immunity. That people who are relying on herd immunity, again, the only ways to achieve herd immunity is if the majority, almost 80 to 90% of the population is immune, either through previous infection or through immunization. Now, if you have an infection where people are not developing antibodies, or those antibodies are short-lived, how can you say you will get herd immunity? You cannot. At this stage, we cannot. And so we have to use this behavioral vaccine. And the behavioral vaccine is wash your hands for 20 seconds before touching your eyes, your nose, your mouth. It's watching your distance wherever possible, and it's wearing the mask. The mask is key. So that's very important. Did I bring up the point about Taiwan?
Yeah.
So again, this is a country that's managed to go without any lockdown, only using the masks, and less than 500 cases so far, and only very close proximity to China, where the actual whole pandemic started. So it's very important. If there's one take-home message of this entire talks, is what I said in that cartoon at the beginning, is that together, collectively, we can all stop this accelerating pandemic if we modify our behavior, and we continue to do that until the pandemic ends. But we don't know when that is.
Can I ask one question?
Yeah.
Dr. Sandhya?
Yeah.
With the behavioral change, I have put in a mask on my face now.
Wonderful.
So now the question is that how I'm talking about future. Current is going on, and many things and many deliberations have been made by all the experts in this panel, including you. We are looking for the vaccine. Vaccine is going to be a delayed process because we do not know. It will take 1 year or 2 years of time. So 2 years is a longer period for people to have a kind of a different. So how do you suggest that, and definitely people will get a different kind of trauma also in between, and larger pressure, whether economic pressure or living different style, not meeting people, not maybe meeting their own people, जैसे घर वालों किसी से मिलते हैं, दोस्तों से नहीं मिलते हैं, तो इसमें प्रेशर और बिल्डअप होता है. और जो आप कह रहे हैं, बार बार कह रहे हैं कि आपको पैनिक नहीं होना है, टेंशन नहीं लेना है, और जो जगह जो टेंशन खत्म होता है और जो जगह वो होता है, वो सारी चीजें बंद है अभी. तो क्या अभी हमारे मेडिकल ट्रीटमेंट में ही ये पेंडेमिक कोविड-19 के ट्रीटमेंट में कोई इस तरह का प्रावधान या कोई इस तरह के मैकेनिज्म ड्रॉ किए जा सकते हैं जहां पे इनको भी ट्रीट किया जा सकता है, ऑनलाइन फैसिलिटीज क्रिएट करके, या कहीं पे है तो लोगों को बता सकते हैं कि अगर आप इस तरह के पैनिक और वो होता है तो यू कैन गो, जैसे आपने नेटफ्लिक्स का चर्चा किया, यू गेट इन डिटेल. So similarly, अगर कोई psychosocial इसमें होता है, तो many family I'm seeing that they are complaining about their children also, और उसमें वो भी कह रहे हैं कि हमारे बच्चे बड़े हैं, they get panic if their parents go out. उनको ये लगता है कि अगर इनको कुछ हो गया तो my world is closed after that. तो इस तरह की चीजें देखने को मिल रही हैं. जो बच्चे अकेले हैं, जो बच्चे 2 बच्चे हैं और पेरेंट्स दोनों वर्किंग हैं, बाहर जाते हैं, कांस्टेंट उनका एक्सपोजर है, तो बच्चे भी बहुत वरीड हो रहे हैं, बहुत पैनिक में रह रहे हैं घरों में. तो इसके लिए क्या समाधान डॉक्टर सजेस्ट करते हैं?
Well, if you can, that's a great question, and that also addresses one of the questions that somebody sent in. And if you can allow me to share my screen again.
Just a minute. Yeah, I'm making you play. Yeah, now you can share it.
So it's very important for us to address this issue of the silent pandemic. क्योंकि किसी ने पूछा कि can we reflect on the psychological impact of COVID-19, specifically the rising cases of suicide and the fear of living with COVID. So, I mean, this is an extremely important issue. And something that, you know, every family should talk about. जैसे आपने कहा था कि, you know, 2 बच्चे अगर होंगे, or, you know, the parents are going out and they're worried. I mean, I had the same conversation with my 2 teenage children at the beginning of the pandemic. I mean, you can imagine how terrifying both parents, my husband's a surgeon and me being a GP, hearing that doctors are dying, you know, like both of them were panicked, you know, what's going to happen to our parents. And so we had to sort of explain to them that, you know, it's okay, you know, we will take all the precautions, and, you know, this too shall pass. We need to, it's very important as parents कि हम ये experience को हम अपने बच्चों, you know, अपने लिए थोड़ा सा हमको reframe करना चाहिए, क्योंकि this is, you know, 1 in 100-year event that has happened, and probably the worst event that has faced humanity in a long time. But ऐसी बात नहीं है कि ये पहले नहीं हो चुका है. Like, you know, in our grandparents' times, उनको, you know, एक के बाद एक event हुआ है. Like, you know, Spanish flu हुआ, फिर, you know, World War I हुआ, या World War II हुआ है, you know, Great Depression हुआ है. You know, one of the greatest things about humanity is its resilience. And I would say कि जो हमारे जो parents की generation में जो value लोगों ने जो IQ पे डाला है, जो, you know, intelligence पे, फिर हमारी जनरेशन में लोगों ने, you know, EQ पे काफी emphasis डाला है कि, you know, आप कैसे emphasize और emotionally आप कैसे connect कर सकते हैं. जो ये current generation है और जो हमारा जो अभी जो time चल रहा है, I think the most important emphasis is CQ, यानी कि creativity and collaboration. जैसे कि हम अभी ये जो webinar कर रहे हैं, मैं यहाँ न्यूजीलैंड में बैठी हूँ और आप, you know, आंध्र प्रदेश में और लोग दिल्ली में बैठे हैं. You know, this was inconceivable, you know, even 10-15 years ago. I mean, overnight, this pandemic, you know, when it hit overnight, you know, schools turned to online schools, you know, and, you know, people started working from home. In fact, people will be surprised to know, like particularly in New Zealand, I know in several countries, actually, जो पहले lockdown हुआ था, suicide rate actually went down. क्योंकि जो suicides जो लोग, you know, they were doing from, you know, peer pressure at school or whether it was workplace bullying, that all decreased, and जो लोग कर रहे थे वो, they were spending more time with their family members and they were feeling more connected, you know, in fact. So that is, you know, it hasn't been all bad. So that is just one point I would like to make. Now, in terms of now, obviously, the fatigue is setting in. क्योंकि, as I said, ये marathon है. तो इसलिए, because it's a marathon, it's very important that we, you know, try and focus on trying to see how we can make, you know, make do and survive the situation. जैसे कि अगर आपका, you know, career भी loss हुआ है, you know, क्योंकि आप for example, tourism mein hai, yeah, then you need to start thinking out of the box and thinking ki, I mean, what else can I do? Mere dusre skills kya hai? Main kya kar sakta hu? Like, and I'm sure there is something that you can do. And then it comes back to basics, of building immunity and building mental resilience. In fact, I have recorded another video to address this silent pandemic, which is, and in this I have basically addressed depression and anxiety and building mental resilience in the context of the pandemic. And I would recommend that everyone watches this video. It is available on my YouTube. It's a 37-minute video. And I have visualized, just in the same way in my other videos, these concepts of anxiety and depression, and tried to break down the barriers and explain to people when they are problematic and when you should seek medical advice, and also given very practical tips that you can apply yourself to improving your mental resilience, that of yourself and of your children. So that is, one thing which I'm very passionate about. And I think that, even if you can't access medical help or you're feeling lost, I mean, I would recommend you going and watching that video and speaking to somebody else in your family, or, your doctor, or whether it's a counselor or a psychologist. But, we need to remove the stigma, because everyone is suffering, but we are all in the same boat. So, I mean, this is some very simple tips, which again, these slides are in my video, is that, eating well, eating the right food and avoiding junk is very important. Sleeping well is very important for immunity as well as mood. Moving more, so exercise, yoga, cardio, all these things are very important. Loving more. Now, this is very, very important for our moods. Like aap keh rahe the ki, like normally hum, friends se milte hain. We can still meet, but we can, now the pandemic has been going on for 9 months. We have learned a lot. Even with the aerosolized spread, we've learned that the main risky times, the super spreading events, are those that occur, with crowded groups in closed environments with poor ventilation, with a lot of yelling and singing. So you can try and mitigate that risk. You can meet in small bubbles, or you can meet in outdoor areas if possible, wearing masks. You can have, online, get-togethers, and again, be creative about it. But try and stay positive as much as possible, but staying connected and making those connections meaningful. So for children, for example, connection doesn't mean, scrolling down on your, Instagram or your Facebook feed. It is actually connecting. It's not having a fake connection, it's having a real connection. And we can do that via technology. To stress less, I mean, slow breathing, and we've been talking about breathing through this talk. I go through box breathing. I explain it in this video as well as, my COVID management video. Slow breathing is key, because a lot of these feelings of anxiety and loss of control lead us to hyperventilate, which then make us feel like we start getting a lot of bodily symptoms just because of that dysfunction in breathing. So, yoga and pranayama and slow breathing is very important. Keeping a gratitude journal and just thinking of the things on everyday basis of what you are thankful for, and maybe doing that as a family. And also avoiding, alcohol and smoking, drugs and binge eating, eating a lot of junk, because these are ways in which people try and self-medicate all these sort of stresses that they're feeling. But unfortunately, by taking alcohol to calm yourself down, or by smoking, what you're doing is you are reducing your base health, and you are reducing your immunity. You are giving yourself a worse chance if you do get COVID. So these things need to be avoided. So again, there's no easy answer to that question, but hopefully, I mean, I've covered a few points there. And just as I said, stay calm and stay hopeful. There will be light at the end of this tunnel. Already in 9 months, we have learned a lot. There was a question somebody asked about, why is the recovery rate improving in India? And, perhaps it's because we are getting better at, obviously using masks, and also learning about treatments. So there's a lot to be hopeful for. So again, we are all in the same situation, and we all have to get through this together, taking care not only of ourselves, but of each other. So, yeah, I don't know, Professor Kumar, if that answers your question.
Yes.
Yeah. So there was another question about school reopenings, and people were interested in my opinion.
Dr. Sandhya, we are running now out of time, so we will leave school reopening and we will concentrate on the healthcare access in India.
Okay, go ahead. Who wants to talk about healthcare access in India? Yeah.
I think all the doctors, all the experts are here. Dr. Murari is also here.
Dr. Murari, your comments on what are the policies of government-funded plans in order to make healthcare more accessible for the common?
Sorry, ma'am.
Somebody asked the question: Is there any government-funded plan looking at making healthcare in India more accessible for the common man?
Basically, the government of India started one policy that's called Pradhan Mantri Garib Kalyan Package, which is basically for paramedical staff, and it starts from March 30th, and the time is for 90 days. It covers the loss of life due to COVID. Number one, and number two, all the public health service provider, including community health worker, for state, for center, for NGO, for UT, these are covered under this scheme. Otherwise, there is no separate. Otherwise, there is no any separate scheme for other general public.
There's also one, by the Delhi government of those who, regarding the professionals don't.
So your audio is not coming.
Your audio is not clear.
Regarding, apart from this, what here in Delhi also, apart from the Pradhan Mantri Yojana, there was a scheme by the Delhi government that those healthcare professional lives, those who were sacrificed, it with the family will be provided 1 crore rupees, something like that. So apart from that, the other program like motivating the people, these are the schemes which have been there.
Can I make a point here, Dr. Sandhya? So, so wherever you are, I think the most important thing right now is to know your referral pattern, public and private. You want to know, especially if you're somebody who's at high risk, who's has chronic medical conditions, if God, who's your provider can take you, who's your local government referral pattern for your local COVID facility, and as a second fallback, what is the private network you can maybe teleconsult today if you have chronic medical conditions with your physician, or see them, so that you already in your mind are developing network that if I tomorrow was to have this disease, I have all these medical problems, who would I contact? Where can I find a bed? Because these are practical problems that you need to sort out for yourself. If there's a local hospital that has oxygen available, you may not need much more than that if they are treating COVID and they have oxygen facility available. But you need to know your local, both public and private referral pattern, who you will see and where you can be referred. You need to know your networking.
I think that's an excellent point, Vikas, and I think that's part of due diligence. If you're looking at a disaster management plan for COVID-19, a personal family disaster management plan, you have to factor in the worst case scenario. So you need to, especially if you have family members who do have a lot of comorbidities, then you must form that safety net, whether it's how am I going to quickly access, oxygen, you know, there a home ICU facility available. You need to do all of that research now. Would you like to add anything to that, Dr. Maurya?
Yeah, I think that's very important. As you said, family members, those are high risk. The creation of, now we say, the bio bubble, around your house, and then again that you should be aware of where they have to seek the help in case of these problems. Apart from these, the general population, I think we have to also take care of the high risk individuals in the healthcare sector as well. For example, those who are healthcare workers who are high risk. I think they also should be protected in the similar manner as we are protecting, the general population.
Absolutely.
For example, in that way.
So thank you. Any other panelist want to reflect something?
Hi, Dr. Raka. I hope you guys are able to hear me.
Yeah, perfectly all right.
All right. So, just to go ahead and add more to what to be done when it comes to as a parent. I mean, so many different questions, and I would say it takes so much of patience to be able to address each one of them with so much of patience. And I think that's called leadership in your team. And so, what we want to go ahead and give away to parents, who are asking so many questions, is that engage your child in creative activities. And we are in an era where communication skill is one of the most crucial skills. And being able to communicate with your friends, with your family, to understand and create a self-awareness about COVID will take a child's ability to be able to communicate. और अब पैंडेमिक में जब बच्चे एक दूसरे से खेल ही नहीं पा रहे हैं, when they are not able to meet, तो वो एक दूसरे से बात भी कम कर रहे हैं. और एंगेजमेंट का जरिया ऑनलाइन है, तो काफी और भी एडिशनल इंफॉर्मेशन उनके पास अवेलेबल है. तो पिछले कुछ दिनों में हमने एक नोटिस किया कि काफी पेरेंट्स इंटरेस्टेड थे इन टर्म्स ऑफ द इमोशनल क्वोशंट जो संध्या मैम बता रही थी. So I will, like to go ahead and contribute to 3 fundamental exercises, which not just I do, I think everyone who comes around me gets motivated to do so. So I will share that with the parents so they can help their kids improve, their child improve on communication skill. And because it has to do with sound, it has to do with your ability to breathe. The fundamentals are very simple. The first one is the breath that you take and the ability to control that breath right. The second one is the high frequency of your communication skill. And the last one is the low frequency. So the 3 fundamental exercises goes as such. Now, why it is important? Because we all focus on building good personality and good physique. Similarly, it's important to have a good jawline muscle exercise. Very, very important to be able to be a good communicator. So these 3 fundamental exercises are to just begin the journey of being a good communicator. So I'll share those 3 now. The first one is the spelling BOP. B as in Bombay, O as in Orissa, P as in Patna. BOP. And while you produce this sound, you do bop. You give a blow to your cheeks, bop, bop, and you make that sound, bop, 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 bop. अब बच्चे जो है ना वो अपनी स्पीच को करेक्ट करते वक्त खुद नहीं करते हैं, पेरेंट्स को उनके साथ ऐसे खेलना होगा. So you do the first exercise, bop, 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 bop. The second one is the high frequency, where again you take a deep breath, and while you release, you use the word sui, S-U-I, S as in Surat, U as an umbrella, I as an indigo, sui. And while you produce this sound, you do it as sui. So you give a good stretch to your cheeks, sui, and stretch on E as much as you can. Sui. it's up to you. You know, when you begin, it will be very less, but as you practice, it will be very, very extensive. As it says, you know, practice makes one perfect. And the last one is the low frequency, which I think is the universal, you know, access to constant growth and awareness. The Ucharan of Om. So, you know, all the participants of this particular webinar, I'd like to take a special note to thank all of them, because they are the key to be spreading the awareness amongst every one of us. So everyone who is watching, you know, has to go ahead and take the responsibility of absorbing whatever we learn from here and being able to inculcate in their life. And with that level of, you know, self-confidence, we all together can do a one-time home as the third exercise. And I'll begin. It's all up to you. Just have a good time, relax, have a present mind, and we're all in this together. So take a deep breath. I thank you everyone for your time, and we're all in this together, and I think all the doctors are doing a great job. We just need to keep on improvising ourselves and achieving great level of achievements together. Thank you.
Thank you, Milap. Thanks a lot. If any of panelists with any other suggestion to us, otherwise I'll call up Professor Santosh Kumar to summarize this session. Yes, just a minute, Dr. Maurya. Now you Dr. Maurya, now speak again, please.
So what I say, you know, that rather than using the word social distancing, we should use the word physical distancing. We should be connected socially. We should be connected, you know, emotionally. And so physical distancing is more important. What I tell to everybody, that will connect you all, you know, socially, on the, you know, even on the net or everywhere, emotionally, and physically we should be distancing, right? Apart from using, you know, masks and hygiene, respiratory etiquette, I think this is the most important thing which we have.
Thank you, Dr. Maurya. Professor Santosh Kumar, if you are still here listening us, kindly sum up the entire talks, because no one better can sum up the entire talks better than you. Sir, Santosh sir.
Thank you very much. I'm indebted to all the panelists, Dr. Maurya, Dr. Sandhya, Dr. Milap, and also Dr. Murari, and I don't see him, Mr. Yes, Dr. Khaja. Are you there?
Dr. Khaja is here. Yeah.
Yes.
We are grateful to all of you, the way you have conducted the session and the question answer. The first one, and which we had, second one today, the first one earlier and the second we had today. It was very, very informative in terms of that what one should be doing. And this is the biggest pandemic which this generation is facing. We had earlier 100 years ago, but that time we were not there in that time. So, and also our forefathers did not share the experience that they faced in this pandemic, and so we were actually at lost. And thanks to all the doctors and they all came together and trying to find out the solutions of the unknown enemies. Although that we are saying that 100 years it was there, many reports are there that pandemic is going to cost us. But one thing is which is coming from all the discussion, it is the prima facie is that the first thing is that one individual is responsible for one own health. That is the first thing is to be done. And how best we can take care of ourselves by adhering to all the what Dr. Maurya said, that we should not be saying that physical distancing, but we are saying physical distancing, but not the social distancing. So socially much more stay connected. So that is the message which has come up today. Second message which has come up, we need not worry even if we get affected by COVID or any of our dear ones get affected by COVID, keep monitoring constantly, and also advise that you have our home remedies. Dr. Sandhya mentioned many things to be practiced at home, where you can say that. And by technology, Dr. Maurya also advised that keep oximeter at home now, so that you can monitor yourself well. So making an investment of maybe 2,000 or 3,000 rupees would be better for prevention. Third is that every time we go, wherever we go, if you feel that our house is not kind of a safe bubble, then we can have always the mask put on, go for sanitizing and all the practices which were suggested. And another thing which came as that medicine is important, but first care is much more important. So those who are thinking that they are having hypertension or diabetic and all the higher risk or old age, they should be extra careful. And it is also the duty of the children who are at home to take care of their parents, and parents' duty is to take care of their children. So it's a kind of a both way supportive to each other that has come up very nicely. Another thing which came as that always we go for panic. So a lot of devices and practices has been advised to engage ourselves at this time of crisis, whether we are and those activities will help in our improving our immunity itself, whether we take up exercises or whether we go for cardiovascular exercise or we go for breathing exercise or lungs exercise or yoga or pranayam or kind of outside exercises that will help in building our own personal capacity. Hospital comes the last, but doctor comes the first. So whenever you get this kind of a symptom, you do not think that this is a kind of a common cold. Even if it is a common cold that Dr. Sandhya said, go first and doubt itself that yes, it is going to be a coronavirus. So immediately consult your doctor over phone or telemedicine and take the advice of the doctor and keep checking oxygen level. So that is another take which has come up very nicely today. And get yourself much more in the kind of inside activity which you have, but be careful about these food habits which we are having this in the time of corona. How to go for intermittent fasting, and also we go for the managing our calorie and also the weight. So that is also, we should not be waiting for another pandemic to happen. So that was another thing was suggested, that we should be extra careful while managing our health and all. As it was also mentioned that people are having different kind of a symptom. So all kind of symptom could be treated as a kind of a coronavirus symptom, but do not panic and try to monitor. As Dr. Khaja mentioned, that even if the clotting starts happening and that can choke the heart or any other thing, that so that thinner is very much important to have a blood thinning process. So keep exercising or another focus on that. So overall, what I conclude in the saying is that it was a wonderful kind of a discourse on managing COVID, because it's going to be a kind of another 9 months or 2 years. We do not know how big would be the crisis. Still, we do not know. ICMR is saying that already we have crossed that almost a crore kind of a this 100 millions kind of data, or we are still so data discrepancy could be, but the number is increasing. So in that particular point of time, we need to have a say that every day you will find a new number. So these are the things to be taken care of, so that your viral load get reduced, and also the hospital load should also be reduced. Our healthcare professionals, they are every time they are putting kind of their kind of a life at risk and treating the patients. And one thing which have come up as a public policy issue is that how that entire medical professionals who are dealing with their lives, whether they're the doctors or the nursing or the healthcare health workers, from top to down, they should be taken as a kind of some insurance mechanism to be brought in if they can happen. Similarly, how the that like currently in India we give 4 lakhs to any deaths which happen to any disasters, and the COVID-19 has not gone into that kind of approach, supporting that or family who get who the person dies. Maybe this could be a kind of another thought which might come, as Mr. Murari was also mentioning about this, some kind of a public policy. Another thing which came up, that those who are into a higher age and asymptomatic, or maybe they are having diabetic and hypertension, that in the government of India we have a policy that every joint secretary and above, or most of the private sector also, they are having that senior people are visiting to the office. So we need to look at that how this policy can actually be revisited so that the people can be protected as the viral load is what we are saying, that virus is becoming more and more kind of cases are multiplying manifold. So risk exposure has increased. So in the light of above and all the discussions point, I'm sure that people who have attended must have benefited. And I will make an appeal, those who have listened to these presentations of all our senior panelists, the doctors, that this kind of information should not get confined, and they should this information should also multiply more than the virus COVID-19 is multiplying. So that if this kind of a protective information moves out in a multiple format, probably we would be able to take care of our much more likely affected patients in future. So I said that if we have to fight this battle, we have to run faster than the COVID-19. So this information should not get confined to yourself, which you have listened. Share with your better half, share with your family members, share with your family friends and all, share with your neighborhood, share with your all the technology is there. So now you can share with the larger audience so that many lives could be saved, and we can help our doctors, our health services in terms of any kind of a preventive measures. So that is the service which NIDM can take up by making such appeal and organizing such kind of a workshop. And I would make an appeal to the organizers also, that all the Medanta and Fortis and Dr. Sandhya also, to have a kind of a intermittent kind of a, we said that intermittent fasting, but we also have an intermittent kind of a webinar on this issue. It's not that thing is over now. We have to have a kind of a regular because doctors who are practicing, they're finding everything new, every day new things. So that new things should come to the public domain and share that how we can be protected. We can help you also as a reducing the patient load at the hospital, and you can help in reducing the virus load on the patients. So that is how we see that connectivity amongst ourselves and networking. So I'm grateful to all of you. I extend my heartfelt thanks on behalf of NIDM to all of you, and my personal thanks to Dr. Raka because he has been able to organize this as a wonderful, very useful webinar. We are conducting hundreds of webinars, but this I find it's a people's webinar. So how that we can have a kind of a much more people connected to this. So thank you once again to all of you and the entire team of CCDRM. I'm happy about this entire interaction. Thank you.
Thank you very much, sir. Thanks a lot. And thanks once again, Dr. Sandhya. You are the key person leading the entire team and discussing the thing, because medical terms were too much for me sometime. But the way you explain the things, it's really, really helpful. Thank you very much, Dr. Vikas Maurya. He is visiting 500 patients every day. And after that, he is with us and given us time and explained everything very easily. And thank you, Dr. Murari also. Dr. Murari is also too much coming. All the doctors are committed. Thank you, Dr. Kaja, Dr. Saif, Safi. And along with that, Dr. Vikas is also here, but not in the picture. Dr. Vikas, thank you very much. And I would request all of you doctors that we will keep conducting such webinars after 15 days or 20 days or within a month at least, so that new updates, whatever is coming to the technical field, so that we all are aware of it and we can disseminate all these information updates to the participants as well. So, and lastly, thanks to our Executive Director, Major General Manoj Kumar Bindal, and Professor Santosh Kumar, who is the key guidance for all of us. Thank you very much, all of you. Thanks a lot. Sir, kindly allow, now you can allow me to end the webinar right now, and we will have a discussion on our Facebook, WhatsApp group, so that what to do next. Okay.
You may please close, but I wish all the doctors that you protect yourself also. Our good wishes are with you.
Yes. Thank you very much.